Tina.
Good morning.
How are you today?
I'm good.
Good. I'm Chris. I work with Occupational Therapy.
Hi.
I'm going to do a cognitive assessment with you this morning, okay? Part of it's going to have to do with you managing your medication at home when you get discharged from the hospital. The first part that we're going to do is called the Mini-Cog assessment. I'm going to read 3 words to you. I'm going to ask you to recall those words immediately after I say them to you, and then try to remember them because I'm going to ask you to repeat them back to me in a few minutes.
Okay.
Okay, does that sound like something you can do with me today?
I'll try.
All right, great. So the first words that I'm going to say to you are banana, sunrise, and chair. Can you repeat those back to me?
Banana, sunrise, and chair.
Good. Very nice. Okay. So here on this piece of paper, I'm going to ask you to draw me the face of a clock. Okay?
Okay.
Here's a pen. Okay. Can you draw the hands of the clock to read 10 minutes after 11? Okay. Very good. Thank you. So this task is designed to identify a person's ability to manage their medications at home. It's not about your medications, okay? But it'll assess the skills of reading and understanding how to take the medications, which is really important for you. You'll be asked to demonstrate your understanding by setting up the medication box according to the instructions on the pill boxes. Okay, does that make sense to you?
Mm-hmm.
All right, perfect. Okay, so this is the pill organizer. It has 4 compartments, one for morning, so you could take a pill in the morning or at breakfast time. There's a noon compartment. You can take medications at lunchtime or noontime. Oh, okay, I'm gonna pause for a second. So that little bell is a reminder of those 3 words that we had just, I had just asked you to remember. Are you able to recall those words?
Banana.
Mm-hmm.
Chair. I don't remember the 3rd one.
You don't remember the 3rd one? Okay. So the word was sunrise. Okay, but that's not bad. You got 2 out of the 3, which is pretty good, actually. Okay. Okay, so let's get back to our pill organizer. Okay, so as I was demonstrating to you, the morning, noon, evening, and bedtime compartments. Okay, each compartment opens so you can take a pill breakfast or in the morning, lunchtime or noontime, evening time or dinner time, bedtime, before you go to bed. Okay? The pill organizer starts on Sunday. It's a week's worth from Sunday to Saturday. Okay? So this pill organizer is going to hold medications for 7 days. Okay. There's 5 prescription bottles, okay? When you're asked to, you're going to pick up one of the bottles. You're going to read the directions out loud. Then you're going to fill the pill organizer according to the directions on the bottle. When you finish with one prescription, put the lid back on and move to the next prescription, okay? Continue until you are finished with all the bottles, okay? I am going to demonstrate. Before you begin, I'm going to demonstrate the first bottle, okay? I'm going to read it out loud to you. Take 1 tablet by mouth daily at bedtime. Okay, so I'm going to fill the organizer according to the prescription. 1 pill by mouth daily at bedtime. Oops. Okay. I'm going to open bedtime. I'm going to place my pills into the organizer, one in each compartment. Then I'm going to place the cap back on my bottle. I'll place it back down. Okay, now it's your turn to fill the rest of the pill organizer.
Take 1 tablet by mouth daily in the morning. Next one?
Okay. Are you finished
Yeah.
with that one? Oh, okay.
Take 1 tablet by mouth 3 times daily with meals. 1 tablet 3 times with meals. Next one.
Keep on going, yep.
2 tablets by mouth Monday, Wednesday, and Friday in the evening.
Could you read me the bottle again?
Take 2 tablets by mouth. Oh, 2 tablets. Take 1/2 tablet by mouth Saturday at bedtime.
Okay.
Done?
How confident are you that that is filled correctly? That you'll be taking the proper medications?
I feel okay. Some of them were a little hard, but I think the pill box helps.
Mm-hmm. Yeah. I mean, you did it correctly. I originally didn't see you put the Wednesday pill in, but that is correct. I mean, you needed just a little bit of prompting on the one with the 2 pills. That was about it. So you did pretty good with that. Okay, so which of these prescription bottles would need to be refilled in order to fill the pill organizer for next week?
This one, number 3.
It is number 3. Mm-hmm. How would you go about, what phone number would you call to reorder the prescription?
I guess the number on this bottle. 973-97.
So how would you go about refilling that prescription?
I guess I would call them.
Mm-hmm. You'd call the pharmacy?
And then go to the pharmacy.
Yep. That's correct. That is the way you would fill it. So you did pretty good on this. The only real problem here is the clock draw. Her numbers are correct, but her hand placement was wrong. It was supposed to be 10 minutes after 11. So you were only able to recall 2 out of the 3 recall words, which is pretty good, but you have a little bit of a memory deficit. Do you feel like you're forgetting things? Like, are you?
Sometimes.
Sometimes.
Someone usually helps me with my medicine.
Someone helps you. Is there someone in your home who's around a lot? Or are you home alone most of the time when you get home?
My sister usually helps me.
She is. Does she live with you? Does she work? Is she home during the day?
Sometimes.
Sometimes. Are you going to be home all day? by
Yeah.
yourself? Okay, so as long as someone's in to check up on you. Now that you've filled the pill organizer, you have to remember to check the pill organizer and actually take the pill. So there are some apps, they're pill reminder apps, or you can set your phone for reminders. Do you have an iPhone or do you have...
I do, yeah.
Put that app onto your phone and then set your reminders on your phone. And if you have someone to help you set that up at home, they can do that, or I can do that with you to set up the reminders when the time comes of discharge, when we know when your medications need to be taken.
I think that would be helpful because sometimes I forget a couple of them sometimes.
Okay, it's important to take your medication on time and every day so you get the proper dosage.